Hey everybody, it's Patrick. It is Tuesday afternoon, and even though I did a length check on my hair yesterday, my 17th month hair check, I'm trying to keep to a schedule and make sure that I do hair updates every Tuesday, so I'm giving you a hair update today. I don't really have much to report on except a few days ago, someone on my channel asked me if I would take a look at something called Derma rolling or microneedling. I had never heard of this. It's apparently something for hair loss. So I said that I would take a look at it. I want to put in a disclaimer like I do with anything that I try to research about hair. I am not a cosmetologist. I am not a hairdresser. I am not in any way a scientist or someone who has more than just an opinion like anybody else who might do some research online into these subjects. So please do not take this as advice, especially if it's about something that might delve into the medical area. Do check with an expert if you have any questions about how this works or doesn't work. It's just an opinion based on looking up some stuff for a couple of days online. With that said, so what this is it's called derma rolling or microneedling. It comes out of the dermatologist area. In fact, it was originally and it is still used right now as a treatment for acne scars and some other skin conditions. Basically what a derma roller is, or a microneedling device is, it's a small cylinder, about like that big, and all around the cylinder are these microscopic needles. They're very, very small, and it's on the end of a roller. So what you do is you would roll it in the area that you want to treat, and it makes microscopic, like so small that apparently it doesn't even, it's not noticeable to the naked eye. You don't bleed all that much. It's little tiny. You're just basically irritating the skin in order for the skin to react in some way. What I saw the original use was for acne scars. So there's something that has to do with the dermis, that it actually, the irritation makes the skin heal in some way. And again, this is not at all a scientific opinion. So with that, with the fact that it actually irritates the skin and opens up little tiny microscopic holes in the skin, what I've seen is that there are claims that this activates something that will help to cause hair loss to reverse itself. Now, I only will take the word of peer-reviewed journals or scientific or medical studies that look like they are not an advertisement, or from cosmetology sites that look like they are legitimate, aren't selling anything. And from what I can tell, from what I've looked up, this derma rolling or microneedling is used effectively for hair loss in alopecia, and I think that's important because male pattern baldness and alopecia are two different things. One is a disease and the other one is just something that happens to men and sometimes women, where we lose our hair. The derma rolling, the act of irritating the skin and then adding minoxidil or other chemicals or drugs that will actually cause hair growth does work. It has been shown to be effective. It's apparently because the irritation of the skin allows the chemical or medicine to soak in better. That makes sense. You know, if you want to get a deeper amount of material into your skin, if you break the skin, then it's going to soak in a little bit more, and that makes sense. The claims that I don't have a good feeling about are the ones that say that this derma rolling on its own will cause hair regrowth. I have read some things that say that hair sometimes does grow in places that have been damaged. If you've had an injury, sometimes hair does, for some reason, regrow in that place because you've activated something. But I have not seen any study that shows that this microneedling actually does anything on its own to regrow hair. And there is some risk involved with this. I mean, anytime you break the skin, you are at risk for infection. How do you keep this tool clean is what I want to know. If you're rolling it against your head enough to cause some sort of irritation or injury, you are injuring yourself in order to activate something. How do you make sure that that is a sterile tool for the next time you use it? I'm very, very wary of infections. I have gotten infections in the past. I've gotten antibiotic-resistant infections, and if you've ever had one of those, you have to go to the hospital. You have to get IV antibiotics. Not that this causes that, but anytime I hear about when you might have an unsterile device, I wouldn't want to be using that regularly. So, in my opinion, I think that at this time, I probably wouldn't recommend using it to anyone outside of someone who's going to a hair loss clinic or someone who's going to the dermatologist for its intended use or its use in conjunction with something like minoxidil. And I would definitely check with your doctor about it. Anyway, I've gone on for 6 minutes about something that I've just researched for a couple of hours, so I think that is my basic YouTube update. I hope you all have a good afternoon and a good week. I will talk to you again soon.